As we've seen vaccine hesitancy rise over the last decade or so, we've seen an increase in preventable diseases.
Dr. James Jarvis is the president of the Maine Medical Association. In the last 24 hours, he says pediatricians in the MMA's network have already been asked by parents about the new guidelines.
And that's alarming that in just less than 24 hours, we're already seeing parents bringing this up as a subject.
Previously, the federal government recommended 17 vaccines for children. Now it's down to 11. The DHHS removed hepatitis A and B, meningococcal disease, and now only requires a single dose for HPV. For the flu, COVID-19, and rotavirus, families are recommended to consult with their doctors. DHHS Secretary Robert F. Kennedy Jr. says the new recommendations were decided based on a peer review of countries. The U.S.'s updated schedule closely resembles that of Denmark, which recommends just 10 shots. Jarvis is concerned fewer shots will lead to more infections.
Denmark, they have a much more homogeneous population, a much smaller population than the United States does. Some of the data that they use to make these recommendations is not data that we think is consistent with the practice of healthcare here in the United States.
The DHHS says its updated schedule is more reasonable and still keeps children safe and healthy. Secretary Kennedy said in part, quote, "We are aligning the U.S. childhood vaccine schedule with international consensus while strengthening transparency and informed consent. This decision protects children, respects families, and rebuilds trust in public health," end quote.